My friend, so my name is Dr. Sayyeda Amna Mahmood. So today I will select the topic of ovarian cyst. So as you know, the ovary have the follicles. So first we have to know the definition of the ovarian cyst. Is defined as the fluid-filled sac which are developing inside the ovary, the cyst in the ovary. Okay, it is must be in the ultrasound. You have to see the thin line, thin like a wall, and it's the cyst is measuring more than 3 centimeter, having no internal echoes or only few internal echoes, not like too much, and there is a no vascularity on around the cyst on the Doppler study. What is the symptoms of the cyst when the patient have? So symptoms of the patient have is a pain during the sexual activity. There is a difficulty in the bowel emptying, which is also the sometime a cyst causing the pressure. Urine problem, heavy periods, irregular periods, bloating in the tummy, feeling heaviness and difficulty, and if there is a she is born to pregnant, she is difficulty to the fertility point of view, she cannot be conceived. So this is the main symptoms or the complaints when the patient are coming with the ovarian cyst. Now there is a many types of the cyst is only I am discussing upon the simple cyst, not the complicated cyst. The simple cyst is a follicular cyst, corpus luteal cyst. The cyst of the follicular cyst with functional cyst are releasing estrogen. Corpus luteal cyst are releasing progesterone for the maintaining of the pregnancy, and there is a thicker luteal cyst with the luteal phase having the gestational trophoblastic disease, which have the small cyst, multiple cysts in the ovary, but this is also related to a functional because this release the hormones. And the complicated cysts are the hemorrhagic, and some are the large cyst and the torsion of the ovary, which we are discussing complication of the cyst. Now we have to see here the other types of the cyst, which is mostly present in the premenopausal or postmenopausal stages, which is the hypostimulation of the ovarian cyst and the some of the ovarian cystoadenoma and something, which is we have and hemorrhagic cyst we discuss later. And the postmenopausal is a serous inclusions, polycystic ovaries, ovarian torsion, and ovarian neoplastic cyst. What is the finding in the ultrasound? As I told you, the simple cysts have the thin wall, there is a echo free, and sometimes is a biloculated. Simple cyst also have some septum in it, but this is simple cyst having no any internal echoes and no around the cyst having no no vascularity. And there is sometimes the cysts are attached into the wall of the ovaries, which is adnexal cyst is called. And the cyst is on the ultrasound gives the simple cyst give the posterior accosting shadow, which is just like a darkness in the behind of the cyst. This is called as a posterior acoustic shadow. How to report? You have to report to know the premenopausal or the postmenopausal. First thing. Second, you have to know the how the big the size of the cyst. You have to mention the cyst size in the reporting, and then you have to mention what is the Doppler finding and how you can follow up. And if the cysts are more continue, it is more than 2 to 3 months, you have to advise one to see CA1 to 5 to exclude the any neoplastic diseases, and also the MRI to exclude the other pelvic relationships. The treatment of the cyst is mostly depend upon the symptoms of the patient. Is the cyst is large and is small, how to have to follow up? Mostly the follow up cyst is after the periods is around 1 month, and if there is continuous cyst, then at the 3 months you have to decide it the more testing. And then there is some you have to note it about the changing in the cyst, like the if the simple cyst have the simple the thin wall, this is very famous picture, And this is the hemorrhagic cyst, have some internal echoes, a thick wall. Endometrioma have some masses in it, and mature teratoma have some masked protruding mass, which is also related to the Doppler. And some malignancies are have the very highly vascular, which we are discussing the later and the different slide inshallah in detail. Thank you so much.